Employee turnover in nursing homes. The United States is currently facing a significant shortage in the nursing field. This is evident in all settings. However, it is particularly critical in long-term care facilities, that is, nursing homes. Facilities have shifted much of the direct patient care that has been typically provided by RNs and LPNs to certified nursing assistants, CNAs, in order to manage labor costs as reimbursement diminishes. The shortage of CNAs is real and is getting worse. The future demand for nursing professionals is expected to increase dramatically when the baby boomers reach their 60s, 70s, and beyond. From the year 2000 to the year 2030, the population aged 65 and older will double. At the same time, the number of persons who have traditionally worked in the nursing workforce is expected to remain relatively stable. Recruitment of CNAs is a common problem throughout the country, and vacancy rates are often significant. To further compound the issue, annual turnover rates among aides working in nursing homes are reported overall to vary widely, but range typically from 40% to more than 100% in reported studies. CNAs provide much of the direct care to residents of nursing homes. The shortage of staff has significant negative effects on the quality of care as well as the costs for the facility. Costs of turnover include recruitment, selection, and training of new staff, as well as overtime and use of temporary agency staff to fill spaces. Indirect costs associated with the turnover include an initial reduction in the efficiency of new staff and a decrease in nurse aide morale and individual group productivity. There are a myriad of internal and external issues which have caused and continue to influence this situation. Chief among them are related to reimbursement, regulations, education, legislation, and work environment. The work environment is often overlooked as a significantly contributing factor to the problem. In my experience in working with healthcare facilities for many years, it is clear that recognizing the very real issues that exist within and among staff which directly affect morale, productivity, and ultimately turnover is often overlooked and present real opportunities to positively impact facility turnover. It is a well-accepted fact that employees leave their jobs because of the person they report to. The unit leader and direct supervisor directly impact the attitude and morale of employees. In our experience, we have seen repeatedly successful managers are highly skilled at influencing others. They help their employees understand how important they are to the facility and believe they cannot over-communicate. More specifically, here's what successful supervisors know and what they do. They realize that empathy is a skill that can be developed and are careful to develop their empathy skills, increasing the likelihood that they will understand how their staff feel when they do what they do. They then use that skill to understand their employees. Next, they value good communication. They know how hard it is to communicate accurately and concisely, and they work consistently to improve communication. They know that it is important to mirror the other person's style, and when they do that, communication improves. The best managers know about their employees' lives. They do not pry or push, but they interact with them in a variety of situations and actively listen when they offer information. Successful leaders then are able to follow up with appropriate questions or express appropriate concerns. They also learn about what is motivating to their employees or colleagues. They recognize which things in the environment bring out the best for each individual. Successful leaders understand behavioral styles of those around them. They understand that when people more successfully interact, that work improves. Those who are the best at engaging their employees and co-workers also appreciate the value of combining the knowledge of strengths and motivators with an understanding of behavioral styles in order to propel results to an even higher level. They individually consider each of those working with and around them, allowing them to work as much as possible on projects that require their strengths, and then work to shape the environment to support each individual's motivations. So, what can a supervisor or team lead do to improve the engagement of their employees? One place to start where we have seen quick results is understanding the communication style of yourself and then your employees. Those invested in improving employee engagement can start with improving communication. Do you understand your employees' preferred communication style? Is it similar or different than yours? How might you as a supervisor improve communication? If you are a supervisor of direct care staff, including CNAs, and are interested in your level of decisiveness and communication, and suggestions on how you can maximize these traits, we invite you to click on the link in the description box below the movie to learn more about your behavioral style and take a free copy of the profile that we most often recommend for healthcare workers.